Thank you. Nothing. Oh, thank you. I was like, I'm not really so good. Let's get that.
You must be very tired.
Thank you so much.
And I take the credit. I take the credit. There were MDC students.
My name is Yasmin, I'm a doctor working in South Wales. This is a vigil organised by healthcare workers for Palestine, an umbrella group of NGOs and individual healthcare workers. This is the fourth week in a row it's been running. 15 cities across the UK are taking part and 7 internationally. It's endorsed by the Médecins Sans Frontières and Doctors Without Borders because of the dire situation in Gaza, the mounting death toll amongst civilians and amongst healthcare workers. 254, as of 28th of November, 254 healthcare workers were killed in Gaza. The depletion of hospitals, so over 40 hospitals are now entirely dysfunctional. The rising numbers of civilians with serious injuries, including children with multiple limb amputations, severe brain injuries and severe whole body burns, comes just as these healthcare workers are being taken away just as they're needed at the most. The Médecins Sans Frontières have called repeatedly for a ceasefire, which is unusual. The gravity of the situation is severe enough that they have broken their usual policy of neutrality and called for an outright ceasefire and a permanent ceasefire. We, as healthcare workers, we cannot stay silent with these enormous casualties. We call on our government to demand an immediate and permanent ceasefire.
Hi, can you hear me? Yeah. Hopefully it will stop echoing. So I'm Dr. Kassim, GP in Newport. First, we'd like to read out a statement written by a coalition of healthcare worker charities, agencies and NGOs. So this is an open letter to the Prime Minister, which has been signed by over 5,000 UK health workers. Since the drafting of this letter, the situation in Gaza has further deteriorated, and there have now been at least 254 healthcare workers killed, and many hospitals are no longer able to treat patients. For the attention of the Prime Minister of the United Kingdom, Mr. Rishi Sunak, the constant stream of horrifying images from the Gaza Strip compels us as a coalition of non-partisan UK medical professionals and medical charities to write to you with one simple message. We call on you, the British government, to demand an immediate ceasefire. Over 10,000 people have now been killed in Israel's indiscriminate bombardment of Gaza. 2/3 of them women and children. 1 child is killed and 2 children are injured every 10 minutes in Gaza. Israel's assault has damaged hospitals, clinics, overcrowded humanitarian shelters and ambulances. Almost 200 healthcare workers have been killed, 16 while still on duty. 70% of primary healthcare centres and 39% of hospitals are now out of service due to damage, insecurity and lack of fuel. I'd say that's probably more now, since this statement was sent out. International law prohibits attacks on healthcare and demands that healthcare personnel be respected and protected during conflict. Through its persistent attacks on Palestinian healthcare, Israel is in breach of international law and endangering the health of 2.2 million people in Gaza. The 16-year blockade of Gaza, now tightened to a total closure, has deprived civilians of basic necessities. It is a form of illegal collective punishment. Without adequate food, water and fuel, a public health disaster of starvation, dehydration and infectious disease is looming. We echo the heads of major UN agencies and leading NGOs who stated an entire population is besieged and under attack, denied access to the essentials for survival, bombed in their homes, shelters, hospitals and places of worship. This is unacceptable. We support the World Health Organization in opposing Israel's evacuation orders against 12 hospitals still functioning in northern Gaza. The forced evacuation of patients and health workers worsens this deepening humanitarian public health catastrophe. We join our colleagues from the Lancet in reiterating the global #NotATarget campaign, calling on politicians and policymakers to protect civilians from harmful military action, particularly frontline workers such as journalists and healthcare workers. We stand in solidarity with our colleagues in Gaza, who are crying out for international protection. They are overwhelmed, exhausted and scared, working in the most abject conditions. As a collective of UK-based healthcare workers, including the social media platform @Gaza Medic Voices and medical charities, we cannot stay silent on this humanitarian catastrophe and the avalanche of human suffering our colleagues in Gaza are dealing with. We therefore, calling on you in your capacity as a British Prime Minister to 1. Demand an immediate ceasefire in Gaza to end the bombardment and allow aid to flow to those who need it. 2. Uphold the rule of international law by condemning the killing of our colleagues and attacks on healthcare and civilian objects. 3. Demand unfettered humanitarian aid into Gaza, including for food, fuel, medical materials and emergency medical teams. We will now read out the names of all the healthcare workers killed so far as a result of Israeli bombardment and targeting of hospitals and healthcare facilities.
Names, and regrettably it's only accurate up to the 28th of November. It's already out of date. Doctors: Dr. Omar Farwana, Dr. Aya Farwana, Dr. Ahmed Sidan, Dr. Mohammed Dabour, Dr. Tamer Al-Khayyat, Dr. Mahmoud Al-Khayyat, Dr. Serena Al-Abtar, Dr. Saeed Rabia, Dr. Muhammad Al-Samaria, Dr. Rafat, Dr. Ibtihal Al-Astar, Dr. Dua Awad, Dr. Mu'ath Nabahim, Dr. Yusuf Jadallah, Dr. Inas Yusuf, Dr. Isra Al-Ashqar, Dr. Abdullah Ashur, Dr. Hamam Al-Deeb, Dr. Mundir Abu Sariya, Dr. Dua Al-Halim, Dr. Mohanad Izarafana, Dr. Muhammad Rafat Makki, Dr. Maysara Azmi Al-Rais, Dr. Mu'in Ashrafa, Dr. Abdullah Al-Badri, Dr. Hashim Al-Badri, Dr. Omar Ziyara, Dr. Ahmed Hassan, Dr. Basil Mahdi, Dr. Ra'id Mahdi, Dr. Muhammad Idwan, Dr. Hamam Al-Nawh, Dr. Khalil Al-Nakhal, Ma'moon Afana, Dr. Muhammad Afana, Dr. Anis Mahdi, Dr. Tasneem Abdul Nabi, Dr. Ureim Al-Rais, Dr. Amin Al-Bahtiti, Dr. Samir Al-Mahdi, Dr. Saoud Al-Nakhal. Students, medical or dental: Bisan Halasa, Shayma Saida, Abdul Rahman Abu Shwala, Noor Al-Ashqar, Yasir Al-Akhas, Osama Abu Safia, Doha Dahush, Hanina Shannat, Abdullah Abu Jayab, Zainab Azam, Muhammad Abu Jdain, Ragad Abdul Nabi, Dima Al-Masri, Yusuf Al-Dajani, Amal Al-Hijazi, Ru'a Hamam Haniya, Lina Al-Hur, Afnan Ridwan, Nada Abaid, Ahmed Mahdi, Omar Al-Dallah, Mu'taz Shabat. Scientists: Professor Saleh Al-Din Zanoun, Professor Ahmed Abdullah, Professor Amin Mustafa, Professor Ahmed Shbeir. Nurses: Muhammad Lubbad, Muhammad Al-Azaiza, Ahmed Mushtaka, Rami Lubbad, Sumaya Kabras, Muhammad Al-Hakuma, Osama Aid Abu Sabiya, Sabr Al-Nimnim, Muhammad Hamad, Muhammad Al-Baz, Sulaiman Al-Buzur, Badr Muhammad Al-Daqash, Shayma Rayyan, Maryam Abdullah, Wala Alwan, Rawa Al-Thalathani, Samah Rashid, Rida Al-Masri, Ibrahim Al-Rasa, Amjad Al-Mawla, Ibrahim Al-Farah, Al-Suhair Jbara, Hassan Al-Halawawi, صبحة الشرفي، عزمي الجمال، يوسف الشريف، حديل فرقة، عماد سليم، عناس زليم، هبة سلامة، نهى سليم، عمرو مسعود، هيدي الخدير، محمد المخيم، علي نصر الله، طارق أبو عبيد، أحمد أبو الويرد، عبد الرحمن شهيد، أحمد محمود أكرام، يحيى عبد الله جدع، هيثم توفيق النبي، لؤي الزهيري، سالم أبزور، وليد المهلاوي، رضا الكتاني، دعاء الشور، عامر الرملاوي، سفر زينو، سجل دقموش، مؤيد عزة الفانا، رمضان دقموش، مؤمن عرب، عون نوفال عاشور، آية عوني أبو زيد، مصطفى عبد المؤمن، سهر رقيب، عبد الله أبو سلمان، يوسف أبو رقيب، باسم شمس، مهدي عشيز، رائد ملكة، يوسف عريان، تامر مؤبد، مصطفى فؤاد عبد المنعم، مريم البياع، مروان أبو ريدة، paramedics، حاتم عوض، خليل الشريف، أحمد الدحمان، يسري المصري أبو بيد، علاء أبو غنيمة، ناجي الفيومي، محمد خطيب، طارق الشور، محمد أبو مشايخ، نافع النطور، محمود عثمان، محمد العمون، إبراهيم مطر، ياسر النصري، عمر الحباش، محمد المقيد، فارماسيست، أحمد المصري، أحمد سامح أبو هريد، أسطال، شريف أبو الجباس، عمان أبو جليل، سهرة وفوق حسين، إبراهيم مختار، محمد علي، نياء خلف، نسرين الدماغ، سارية عيدي، محمد الشناط، لينا أبو منالف، نور إبريم، حنين البسيوني، أمير الرحمن، روان البلد، خالد المعين، أمل مكي، عبد الله الترطوري، أسماء أبو صالح، محمد الشامي، بلال عبار، أحمد التربي، آية حجازي، رضا طويل، أحمد العباسي، وسام الحلبي، ندى الدهشاني، إحسان عبد الرب، لاب تكنيشنز، نصير شبان، أسماء حجازي، روان ياسين، عليا الحناوي، مريم هباجة، نهيد عبد اللطيف، محمد عبد الكرش، محمد شعبان، ريهام الكحلوت، إسماعيل شرف، تيسير الهوتي، عبد المحسن محمد أهل، optometrist، عمر خورشيد، سمير خورشيد، محمد خورشيد، أميد خورشيد، أحمد أبو رجب، أسامة أبو رجب. Administrative staff in the World Health Organization Hospital, Dean Abdullah Al-Latif. This long and growing list. So, of the 100 Palestinians killed today, since resuming bombardment this morning, we know at least 3 were healthcare workers, including 1 medical student about to finish. This list is 35 people longer than it was when I read it out last week, and it continues to grow. We echo the calls from the Médecins Sans Frontières, Doctors Without Borders, who normally remain neutral, but have, in an unusual step, broken ranks and called for ceasefire, and have done since the 1st of November. One of their chief executives makes the point that the pattern of violations of international law was so repetitive and so predictable that they had no choice but to call for a ceasefire. They noted with sadness the killing of 3 doctors at the bedsides of patients at Al-Awda Hospital due to a direct airstrike on the 21st of November. We also hear distressing reports from within Gaza of healthcare workers kidnapped on their way along the safe route from the north to the south. These are healthcare workers who tried to stay to the bitter end for their patients in the northern Gaza hospitals. And as they then evacuated along the supposed safe route with their families, at least 12 are now reported missing. In line with all the NGOs, we honour their memory and we call for the release of those held hostage, and we call for the protection of healthcare workers going forward. I'll now call for a minute's silence. as some of their experiences over the last 7 weeks.
Hi everyone, I'm Mustafa. I'm a final year medical student. So this is a statement from Hamam Aloh, doctor, 56-year-old nephrologist at Shifa Hospital, spearheading a new renal facility in Gaza. He was interviewed by Democracy Now! On the 31st of October. 11 days later, he was killed in a missile strike on his family home, which killed him, his dad, and family members. Another statement by Dr. Mesa Al-Rais, 30 years old, a medical doctor who graduated from the Faculty of Medicine at Al-Quds University in Gaza in 2019. He was president of International Federation of Medical Students Association, IFMSA, in Gaza for 2 years. He received a Chevening scholarship and obtained a master's degree in Women and Children's Health from King's College London, UK in 2021. The scheme is seen as a pillar of British diplomatic prowess, funding places at UK universities for overseas applicants. It describes as global leaders and decision makers of the future. More than 15 Chevening graduates have gone on to become heads of state.
I'm also a final year medical student at Cardiff. On the evening of 15th October, Dr. Sidan needed a rest. The 47-year-old surgeon had not left the Al-Shifa hospital in Gaza City for more than a week. He told his colleagues he was going home for the night, but a few hours later he was killed in a strike at his home. This calm, funny and kind-hearted man came back to the hospital the next morning, but as a lifeless body. His colleague Dr. Adnan Al-Bush explained. Dr. Al-Bush, who had known the surgeon for more than 20 years, added that his late colleague had been nicknamed the relentless surgeon by his peers for his dedication to the job. A veteran of the operating room, Dr. Sidan was also known as a great mentor to younger doctors. If any of the doctors faced any difficulties, they knew Dr. Sidan was the one who would sort it out, agreed Dr. Ahmed Sidan, the head of the plastic surgery department at Al-Shifa Hospital. His death is a huge loss not only to this hospital, but also to the medical profession, he added.
Thank you. It's my great honour to invite Mr. Carolyn Griffiths, a member of the Senate for Plaid Cymru, who has very kindly supported the Vigil and supported the call for the ceasefire.
Good evening, and it's good to be with you this evening. And we're here tonight to remember the medical professionals who have been killed in Gaza. We're here to call for a permanent ceasefire. We're here today to call for peace. As we said, I've been here with you over the last 2 weeks at this event. And last week we were hopeful that the truce would hold and that we wouldn't need to meet. But we're here again tonight. We were hopeful that the killing would stop. We were hopeful that no other names would be added to the list. But we've heard that sadly 35 more have been added. I talked last week about the anger, the grief and the despair. But even though this week we've seen hostages and captives released and the truce, however fragile, holding for most of the week, we've heard that the violence started again this morning. As I said, only a permanent ceasefire will stop the violence. A humanitarian pause only pauses the killing. It doesn't solve anything. I still feel the same anger at the senseless killing, the grief and the thousands of innocent people dying, and the despair at not being able to directly change the situation as I did a week ago. But I still cling on to hope. Hope is so precious. Hope is the light in the darkness. Wales is a beacon of hope because we passed the Plaid Cymru motion in the Senedd calling for a ceasefire. Wales is a beacon of hope because we are a nation of sanctuary, where we have opened our arms to refugees from conflicts all over the world. Wales needs to be a beacon of that hope for the displaced people from Gaza and Palestine. That's why Plaid Cymru Senedd members have been calling on the Welsh Government to put some pressure on Westminster to open up a refugee scheme to offer hope to those from Gaza and Palestine. I know we're a small country. I know we don't have control over refugee policy here in the Senedd, but I also know that we open our arms of friendship and peace to our international brothers and sisters when they are fleeing death and conflict. We do what we can to bring hope to others. That's why we're here this evening, to call for a permanent ceasefire now, to call for a refugee scheme for the displaced people of Gaza and Palestine, and to call for an end to the killing, and to call for a lasting peace. Diolch yn fawr.
Thank you very much. It means a lot to have the solidarity, and we salute the Welsh Senedd for calling for a permanent ceasefire so early in this horrible situation. It's my great honour to introduce Jenny Ratcliffe MP for Labour, who is also here with us this evening.
Thank you very much, and thank all of you for coming here this evening after a long day's work serving the NHS in Wales. So it's really humbling that you've all done this after a long day's work. But it's really important that we remember all the brave medical personnel who've risked their lives and sadly, in so many cases, have lost their lives. I just wanted to speak about one individual who I read about this week. Dr. Youssef Mahdi, who worked in the maternity unit at the Al Mahdi Hospital. Two of his brothers were also doctors. Unfortunately, they were on the list of people that were read out already as having been killed. And tragically, nearly all the members of Dr. Youssef Mahdi's family were killed in the bombardment of the hospital, because they'd gone there to shelter, thinking it was a place of refuge. But it is absolutely tragic that the Israeli army and the Israeli military is simply not respecting hospitals as the places of sanctuary for civilians. And that is why we absolutely have to have a renewal of the demand for a permanent ceasefire before any more lives are lost, as it is so tragic that at least 179 people have been killed today and have been taken to these depleted hospitals where services are so inadequate for dealing with the horrible wounds that they have suffered. So this is a complete tragedy, and we all need to plead with the international community to get a ceasefire so that both sides come together and stop the killing.
Thank you. It's my great honour to say that we have Unison with us today, and I'd like to invite our Unison representative to speak for us today. Thank you.
Good evening, everybody. It's a pleasure to be here. Unison, the international trade union movement, stands united in its condemnation of the devastation and violence we have seen on our screens. We stand in solidarity with all those who mourn the loss of loved ones, and we urge the leaders of the world to demand humanitarian ceasefire now.
This brutal and indiscriminated bombing campaign has left no safe place for Palestinians, claiming thousands of lives and resulting in life-changing injuries for thousands more. In Gaza, neighbourhoods have been turned to dust and over half the population displaced. The Israeli government have literally turned off water, lights and over 2 million Palestinians, depriving them of the most basic human rights of water, electricity, fuel and essential medical supplies, intensifying the land, sea and air blockade that has devastated Gaza for 16 years. News reports tell us that over 1 million Palestinians have been displaced. The reality is they have been driven from their homes by bombs and by fear of death. The collective punishment of the people of Gaza is a war crime, and it must stop now. The shortage of the most basic essential medical supplies, reports of no painkillers, no anesthetic drugs to allow surgery. We have seen in recent weeks and stand against those who seek to divide the communities. And in our class, we are always stronger when we stand united. Today we send a message to the British government and the international communities to demand an immediate ceasefire and humanitarian corridors. They must ensure human rights are protected and the Israeli government must respect international law and cease the bombardment. We demand an end to the needless loss of lives. We demand the implementation of many United Nations resolutions that remain unheeded. Solidarity is the most important. It comes in many forms. Massive demonstrations like we see here and around the world make a difference. We make a difference. But solidarity is also about taking on our own government, the government that backed the bombing in Gaza, that sell arms to Israel and allow companies to profit from the occupation of Palestine. We must get rid of this government. Solidarity to Gaza and ceasefire now.
Thank you, Lorna Hood, Council for Unison. We thank you for your solidarity in standing with the people, the healthcare workers in Gaza and the normal civilians in Gaza who are facing this horrendous, indiscriminate bombardment. I'd like to introduce next Costas, an A&E doctor who's going to read a statement of support.
My name's Costa Morley. I'm a doctor at Rocket Grange Hospital in Cwmbran. I just have a short statement to read. This is from Carolyn Thomas, who's a member of the Senate from North Wales. Closing. I'm sorry that I cannot be with you in person this evening, but rest assured that like peace-supporting people the length and breadth of Wales, I am with you in spirit. The situation in Gaza is utterly harrowing to view from a distance, and therefore completely incomprehensible to understand what it must be like in person. Healthcare workers on the ground have been carrying out heroic feats to save lives, assist the injured, and provide hope for Palestinians facing constant barrage. It is devastating that so many healthcare workers have paid the ultimate price for the sacrifices that they make for their patients. It is unconscionable that so many have been allowed to be indiscriminately killed alongside thousands of innocent Palestinian men, women and children. Events such as these vigils happening up and down the UK represent an outpouring of both public grief and public opinion. The case for a ceasefire in Gaza gets stronger with every passing second, and that call is being articulated by millions of people across the world. It is the global call for peace which we must all take hope from, and we must also take hope from knowing that every Palestinian saved by a healthcare worker in Gaza will hopefully one day be in a position to help rebuild their country. You have my total solidarity and you have my total support in calling for an immediate ceasefire in Gaza. Message from Carolyn Thomas, Labour MS. Thank you.
It's my pleasure to introduce next Laura, an A&E nurse, to read a message of support from Jane Dodd.
Hi there, I'm Laura. I have a statement from Jane Dodds from the Liberal Democrats MS. I would like to begin by thanking global healthcare workers for Palestine for organising this vigil in honour of healthcare workers who have been killed in Gaza. I am so humbled by the bravery of those healthcare workers who risked their lives to care for the people of Gaza who have been caught up in this dreadful conflict. A conflict which must be brought to a peaceful end. I have, and always will, call for an immediate ceasefire. It is time we bring an end to this terrible conflict which has taken the lives of innocents on both sides. It is often the case in any war that the ones who suffer the most are innocent civilians caught up in the chaos and violence that conflict can bring. The Israeli-Gaza conflict is no different. Since October, an estimated 5,500 more children in Gaza have been killed, with thousands more missing under the rubble of destroyed homes and hospitals. In Israel, 33 children were killed during the October the 7th attacks, and a further 40 taken hostage. This terrible conflict must be ended with an immediate ceasefire. The children of both Gaza and Israel deserve to live in peace. That's a statement from Jane Dodds, Liberal Democrats, MS.
Thank you all so much for being here, for braving the freezing cold. We won't keep you much longer. Just some concluding remarks. I think, like many of you here, today was a heavy morning and a heavy day, and it's been a sick day all day to know that we got peace and we went backwards. What I will say for a message of hope is that, exactly as Claudia pointed out earlier, all of you have been busy all week, busy all day, and you've come out here through the traffic in the freezing cold to stand here because you feel this matters. This is happening in 15 cities across the UK because people feel this matters. It's happening in 7 international cities today because people feel this matters. You are the people who brought the pressure to bear. You are the people who made those in charge change tack. You brought the 7 days of ceasefire, and you can do it again. And for that, we give you all our thanks. Thank you.